Hello, and my name is Kate Cassidy. I'm here today to talk to you about stopping smoking. So, quitting smoking is the most important thing a person can do to improve health. If you have COPD or any other respiratory disease, it is very important that you stop smoking to avoid damage to your lungs. The most important message I have for you today is, no matter how long you've been smoking, there are still great health benefits in giving up. It is also important that you are not affected by passive smoking, which is other people smoke, as this is also a health risk to you. Stopping smoking is the single most important thing you can do if you have COPD. In addition to behaviour support you get when you talk to somebody trained to help you quit smoking, like Colm, who's going to speak to you, many people find help from stop smoking drugs, of which there is a variety. Today we will be talking about the best advice that is out there at the moment to support somebody like you. Treatment and care should always take into account your needs and your preferences. People with COPD like you should have an opportunity to make informed decisions about your care and treatment. This should be done in partnership with your team and your healthcare providers. Since smoking or exposure to smoke is the most common risk factor for you getting episodes of not feeling well, called exacerbations, this should be high on your list to address, even if you are someone who has attempted to stop on a number of occasions before. The second message I want you to hear today is that if you have stopped smoking, well done, and we will continue to support you over the next year. If you are still a smoker, never give up giving up, and we will support you at all stages. It can be done, and every day people like you give up. Nicotine addiction is a medical condition rather than a bad habit. People who stop smoking still have receptors in their brains that were once hooked on nicotine. These receptors lie dormant, waiting to be turned on again by just one cigarette. If these receptors are turned on again, the addiction cycle can start again. This is why we have a not a puff rule. The not a puff rule, the most important message for people quitting or who have quit, is to support you not to take a single puff of a cigarette. For the majority of smokers who were once heavily nicotine dependent, the potential for relapse continues to be a lifelong possibility. Don't be tempted to try just one cigarette, as all the receptors will waken up and demand more nicotine and you go back smoking. There are immediate benefits of quitting smoking. Blood carbon monoxide levels. This is the smoke that's in your bloodstream, returns to normal within 36 hours. People often think it's the nicotine that causes the damage in cigarettes, but in fact it's the smoke. Anything lighting produces carbon monoxide, for instance, the exhausts of cars and chimneys. When this smoke, carbon monoxide, is inhaled by the smoker, it's a toxic gas and starves the blood of oxygen, meaning the heart and lungs have to work harder. We have a carbon monoxide machine, and this will measure your levels as a smoker, but also as a non-smoker, it gives you a before and after number. You'll notice from the chart that your levels may go into the red or amber region. However, it only takes 1 day, 24 hours for carbon monoxide from smoking to come out of your blood, and you can look forward to a green reading of a non-smoker. This means that you have more oxygen available to your body and all of your organs, and they have to work less hard to feel better. Your breathing improves immediately as your lungs are not full of smoke. When you smoke, you are stimulating all of your receptors in your windpipe to produce mucus, and your lungs need to clear that mucus, so you cough. You'll have fewer respiratory ailments, again because you are not filling your lungs with smoke and mucus. You stay healthier. The blood flows easier through your blood vessels because your blood is full of oxygen and there is less tar in your blood vessels. Your circulation improves. You sleep better as you're not coughing and you have loads more energy. In 1604, the world's first health warnings came out about smoking. James I described the habit as loathsome to the eye, hateful to the nose, harmful to the brain, and dangerous to the lungs. Smoking amongst patients who suffer from COPD are often higher than those of the general population, and in many cases, smoking has directly contributed to the development of your condition, and continued smoking is known to speed up the progression of your condition and increase the risk of further complications. Passive smoking, that is, breathing in somebody else's smoke from people's cigarettes, will inhale some of the chemicals and carbon monoxide as a result of passive smoking. Even in a large room, if you can't see the smoke, it is still being inhaled, causing health problems. Make your house completely smoke-free. If this is not possible, at the very least, have one room that is completely smoke-free at all times for your use. Ask people to smoke outside whenever possible. If it's raining, ask them to smoke at an open window or shelter. When driving, ask people not to smoke in the car. Instead, they can have a smoke break. Remember, you are not trying to be awkward. People who smoke in front of you are affecting your health, so they must move away. Your healthcare provider has been and will continue to offer you stop smoking advice. They ask about your smoking history and advise you to quit, and also arrange for you to attend a stop smoking clinic. There has never been a better time to quit smoking, with so many treatment options available to you. These stop smoking drugs are safe and can increase your quitting attempt, and when you get some stop smoking advice, it increases your chances fourfold. We know that the best plans for quitting are put together by the patients themselves. Our Stop Smoking specialist will help you to identify your own solutions, as you know best what you are capable of achieving. We will leave you in charge of your own timescale and progress.
My name is Colm O'Connor and I'm a smoking cessation officer based in Kilkenny. I've been working in smoking cessation for a number of years now. So I'm going to talk to you a little about what you can do to make quitting smoking a little bit easier for yourself. So I'll go through a number of different tips and pointers that you can use to help you along the way. Number one, motivation. So there's no magic cure to quitting smoking. It has to be something that you really want to do. Write down the pros and cons of smoking and focus on those positives. What do you get out of becoming smoke-free? Once you have your reasons wrote down for quitting, keep them with you at all times, and you can use them whenever you're finding it difficult, just to remind yourself of why you want to quit smoking. Prepare to quit. So pick a date to stop and work towards that date. Choose a time where you're not under any extra stress and stick to the date. So what we'd recommend is that you smoke as normal up to your quit date and not worry about cutting down before then, and then stop abruptly and not smoking a single puff of a cigarette after then. Discuss stop smoking medication with your GP or pharmacist. So by using a recognised stop smoking medication, you can double your chances of success. So when I say stop smoking medication, what I'm referring to is the nicotine replacement therapies, such as the patches, the gum, the lozenges and the inhaler. There's also prescription medication called Champix and Zyban, and they double your chances of success. Keep a smoking diary and change your routines. So a large part about quitting smoking is trying to think about when you might get those cravings. So think about when and where you smoke and write them down. So keep a smoking diary for a couple of days, just so you can identify those triggers. Some examples might be the first one in the morning with a cup of tea or a cup of coffee, maybe after a meal, while driving, and so on. So plan ahead to change these routines, as these may be the times of the day or the places that you find most difficult. So for example, that first one in the morning, if you're used to having a cigarette with a cup of tea sitting in a certain chair, try break that, change the drink, maybe go into a different room, sit in a different chair, and just try break that association. Use a support service. So by using a recognised stop smoking medication and a support service, you're actually 4 times more likely to quit for good. So there's a number of different support services available. There's face-to-face support, phone support, and online support, all available free of charge. So the face-to-face support, you can look up the contact details of your local smoking cessation officer on quit.ie and give them a call to book an appointment. For phone support, by free phoning 1800 201 203, you can speak with a trained advisor who would be happy to guide you and support you through your quit journey. And there's also an online support on quit.ie where you can track your progress and also get daily emails and text messages of support. Learn how to handle cravings. Cravings can seem overwhelming at times, but they tend to pass after about 3 to 5 minutes. So use the 4 Ds to help. Delay. So just wait for a few minutes and the urge to smoke will pass. Distract yourself. Distract yourself from the craving by trying to keep busy and move away from the situation that you're in. Drinking water. Drinking a cool glass of water can help ease the craving and also replaces the hand-to-mouth habit. And deep breaths. So take a few deep breaths, slowly breathing out to help you relax. Cravings become milder and less frequent the longer you remain smoke-free. Exercise regularly and watch what you eat. Nicotine decreases your appetite, so after you quit, you may feel hungrier more regularly. If you find that you're eating more, ensure that you're eating good healthy food like fruit and veg rather than snacking on junk food. Avoid substituting cigarettes with high calorie food. The average weight gain is 5 to 10 pounds, but the important thing to remember is that despite any weight gain, you will be much healthier by becoming smoke-free. Be positive. So focus on the positives of becoming smoke-free, such as the improvements in your breathing, increase in energy levels, improved sense of taste and smell, and so on, and keep that positive attitude throughout. Save money. Someone who smokes 20 cigarettes a day would spend almost €100 a week on buying cigarettes. This is over €5,000 over the course of a year. When you quit, put this money away and treat yourself after a week, and this can be a really good incentive for you to remain on track. 1 day at a time. So the thoughts of quitting smoking can be very overwhelming to people who smoked many years. Smoking would be a huge part of that person's life, so it's important to set small targets and take it 1 day at a time. You may need to break up the day into different parts. For example, just focus on getting through the morning without smoking. And once you do that, you can take the positives from that and build your confidence, and then you can focus on getting through the afternoon. Over time, you'll continue to build your confidence and it will get easier as time goes on.